Introduction. If you are reading this handbook, you or a family member may have been recently diagnosed with type 1 diabetes. You may be feeling worried and will probably have lots of questions running through your head. You may also feel shocked and scared about what changes this means to your life. We want you to know that these feelings are completely normal. We know that all young people feel fed up caring for diabetes from time to time. This is why we have lots of top tips and resources for helping you to manage your feelings. Your feelings about diabetes are really important to us. You don't have to be best friends with diabetes, but building a good relationship with it can reduce feelings of burden. Your healthcare team are here to guide you through these changes and provide support for you and your family. They will work with you and your family to try and keep your day-to-day life as close to the way it was before your diagnosis. This handbook complements the Deapp 2 app and will help to answer some of the questions and worries you may have. It will guide you through the education process that you will receive on diagnosis.
Empowering children and their families to manage their diabetes. Our team. All of our staff are trained in looking out for signs that children and young people might be struggling. Some teams may also have a social worker or psychologist to talk to. Just ask one of the team and they will put you in touch. Team vision. As a healthcare team, we are committed to improving the health and well-being of young people living with diabetes and their family by providing high-quality, integrated physical and emotional healthcare. HealMed. Our mission statement is to empower children and their families to manage their diabetes so they can continue to live a healthy, happy life.
What care can you expect from the diabetes team? 1. They will introduce themselves. 2. You will be looked after by a specialist multidisciplinary diabetes team. 3. You will be treated with respect and compassion at all times. 4. They will explain what is type 1 diabetes. 5. You and your family or carers will be given the time to talk about your feelings and your worries. 6. You will be seen by a dietitian to talk about food and if there are any changes you need to make with what you are eating and drinking. 7. You will be given insulin to take home on discharge. Future prescriptions can be obtained in your 3-monthly clinic appointment or from your GP. 8. You will be given names of diabetes support groups to help you with your diabetes. 9. We will teach you how and where to give your injection and how and when to test your glucose levels. 10. We will tell you what levels your glucose levels should be and advise you how to keep this within range. 11. We will also tell you all about insulin and when to give it. 12. We will teach you how to recognise and when to treat a high and a low glucose level. 13. You will have regular ongoing phone calls and appointments with your diabetes team. 14. You will have a 3-monthly clinic appointment at the hospital. 15. You will be given the telephone numbers for contacting the diabetes team in office hours and out of hours. 16. We will give you a school diabetes care plan and educational resources for you to pass on to your school.
What the diabetes team will expect from you and your family or carers. You will need to attend at least 4 clinic appointments in a year for regular checks on your growth, general health, and screening for other conditions, and to talk about any concerns or problems you may have. You will see a dietitian at least once a year to review your diet and follow advice given. You will need to attend all diabetes education sessions organised by the diabetes team when invited to help you to continue to improve your diabetes care. The aim is to keep your HbA1c less than 7%, to empower you to have the knowledge to manage your diabetes. The diabetes team encourages you to reach out if you have any concerns about your diabetes management. To ensure you have your glucose and ketones testing equipment and strips with you at all times. To monitor your glucose with a continuous glucose monitor CGM, or at least 5 glucose checks a day. To have hypo treatments and snacks with you at all times. To update the diabetes team if you have changed your home address and/or telephone numbers. Do not let diabetes stop you from doing what you want to do.
Helping you get good control of your diabetes. Help and support. Your diabetes team are here to help you and your family manage your diabetes. Your health and happiness are really important to us. They will see you regularly from now on and do their best to answer your questions. There is no such thing as a silly question, so don't be shy. It is really important to remember that you are still you. Don't let diabetes control your life. Instead, take control of your diabetes.
The team. This handbook for type 1 diabetes has been produced to guide you through the education process that you will receive on diagnosis and for re-education. It complements the Deapp videos and it will be a resource that you can continue to use once you are home. There are a range of health professionals who are here to help you manage your diabetes, and you will start to meet members of the team from the beginning. They work alongside you and your family to manage your diabetes until you transition to adult services. Doctors advise you on the appropriate treatment for your diabetes. They see you every 3 months in multidisciplinary clinic, usually a minimum of 4 times a year. Doctors advise on adjustments to your insulin doses and explain test results. They may refer you to other health professionals if required. Diabetes specialist nurses or educators. They offer support and reassurance on managing your diabetes. They are available for advice between clinic appointments, including advice on insulin adjustment. They will teach you to use the equipment needed for checking glucose levels and delivering insulin. They liaise with and educate school staff and provide advice on all aspects of managing diabetes, including exercise and travel. Dietitians will provide advice on eating a healthy, balanced diet. They will teach you to count carbohydrates so you can match insulin to what you eat, and advise on other medical conditions where diet forms a part of your treatment plan. Social workers and psychologists support children, young people, and their families to feel better equipped to manage the ups and downs of living with diabetes. They help to deal with feelings related to diabetes, like feeling different. They help with worries about treatment, such as needles or glucose monitoring. They help with difficulties relating to food, eating, and body image, and provide support relating to how diabetes can affect family life. Administration support, process referrals, and book appointments. They send out text reminders and connect you with the team. To sum up, over time you will get to meet all members of the team. You may see different members of the team when you come for your outpatient appointments.
Session 1. What is diabetes? Diabetes is when your body cannot use glucose, which is a type of sugar. Glucose comes from the food we eat. The glucose from your food is carried in your bloodstream to where it is needed. We all need glucose to fuel our body to give us energy. It's a bit like how cars use petrol for fuel. To help us use glucose as fuel, we need insulin. Insulin is like a key that opens the door to allow glucose to get from the blood into the cells in your body, where it is used as fuel. If you haven't got insulin, the door stays locked. The type of diabetes you have is most likely to be type 1 diabetes, which is where your body has stopped making insulin. If you haven't got enough insulin, the glucose gets stuck in the bloodstream instead of being used as fuel. When this happens, the only way to eliminate the sugar is to wee it out. That is why you are weeing a lot, and if you are weeing a lot, you are losing water, so you become more thirsty. Why has this happened to you? Diabetes is known as an autoimmune disease. Your immune system, which is what your body uses to fight off germs, starts attacking your body as well as germs. It has become confused and starts attacking the cells that make insulin. We don't know why this happens or what causes it. Some people think there is a virus that looks like the cells that make insulin. If you get this virus, your immune system fights the germs. In doing so, it destroys the virus and makes antibodies to protect you next time. Sometimes the immune system gets confused and thinks the cells that make your insulin might be like a virus. The immune system then carries on destroying the insulin cells even after the virus has gone. Once you have those antibodies, they are always there. Your immune system remembers. So if we try to give you new insulin cells, your immune system will kill them straight away. You can't make more insulin cells once they have gone, as you were born with a set amount. Symptoms of diabetes start when the number of cells you have that produce your insulin reduce to the point where they can't make enough. It is quite a slow process and can vary. You may have had this coming on for the last few weeks or months. Remember, diabetes is not a barrier to you achieving your dreams. We have done lots of work to try and see if we can stop this from happening, but at the moment we are only just starting to find medicine that can help. At present, there is no cure for type 1 diabetes, but this should not stop you from doing anything you want to do if you look after yourself properly. It is nobody's fault you have diabetes. It is not because you've eaten too many sweets or you've eaten the wrong food, and it's nothing to do with your weight. Nothing you could have done would have made any difference. We usually find that there is no one else in the family with diabetes. It just happens. The chances of getting diabetes are about 4 in 1,000. However, there is a bit to do with genetics, which is the way your body is put together. If there is someone in your family with diabetes, then those chances of getting it are higher. But most of the time, it just happens. What symptoms do people with diabetes usually have? People with diabetes usually wee a lot, are thirsty, and drink a lot. Sometimes you may have needed to get up in the night and might have wet the bed. You may eat more, feel hungrier, and may lose weight. You might also become more tired and moody. You may have put mood changes down to other things, such as teenage behaviour or changing schools. You may have come into hospital feeling not too poorly or really poorly. However, if you leave diabetes to carry on with no one noticing, you can end up finding it difficult to breathe, have a tummy ache, vomiting, and become seriously unwell. Either way, it is good you are now getting care from your hospital and starting treatment, so you can feel better and learn how to manage your diabetes.
Ketones. If there isn't enough insulin in your body, you can't use glucose as fuel to give you energy. Your body will start to feel tired and weak. Your glucose levels will get higher and higher because the body can't use glucose for energy. So you get energy by breaking down fat and protein. The buildup of ketones in the body is called diabetic ketoacidosis, or DKA. Ketones are acids that are made when your body breaks down your muscle and fat. When fat is broken down, the ketones build up in your body. This can make you feel very unwell because ketones are poisonous and dangerous. It is very important to remember, high glucose plus high ketones equals danger. This is because acid builds up in your bloodstream and then you have to breathe the acid out. This can make your breathing extra hard. That's why your breath may have a distinctive smell of pear drops or nail polish. This is the buildup of ketones in your bloodstream. If you don't do anything about DKA, it can cause your brain to swell, and some people have been known to die because of DKA. For advice on how to prevent DKA, please go to Sick Day Rules.
Treating diabetes. To treat diabetes and get your glucose levels back to normal, we need to make sure you have some insulin. We can do this by giving you either insulin by injection or via an insulin pump. We need to try and copy what your body would do if it didn't have diabetes. To do this, you will need to have 2 different types of insulin if you're not on a pump. You will need an injection of long-acting insulin once or twice a day. This provides a background low level of insulin that is always there. You will also need an injection of fast-acting insulin each time you have something to eat, and sometimes at other times if your glucose levels are too high. The aim of treating diabetes is to keep your glucose levels as near to normal as possible, that is between 4 and 7 millimoles per litre, to keep your body as healthy as possible. 4 to 7 millimoles per litre is NICE UK guidelines. Some hospitals use 4 to 10 millimoles per litre as per ISPAD guidelines. Your diabetes team will advise you. You can check your glucose levels by doing a glucose check or using continuous glucose monitoring, CGM. It is really important to check your glucose at least 5 to 6 times a day. If you do not check your glucose, you will not know what your readings are, and you will not be able to give the right amount of insulin. What is type 2 diabetes? There are also other forms of diabetes. Type 2 diabetes is the most common in adults and a rising number in young people. Type 2 diabetes is where your body is producing insulin, but the insulin is not working correctly or producing enough. This causes higher levels of glucose in your body, known as insulin resistance. There are some things that increase the chances of a child or young person getting type 2 diabetes. These are being overweight, strong family history of type 2, coming from a South Asian or African Caribbean background, having low levels of activity. A very important treatment for high glucose levels in type 2 diabetes is to lose weight if you have a high BMI and maintaining a healthy lifestyle. Many people with type 2 also require medication or insulin. If insulin is the key to your cells, type 2 diabetes is like having a rusty one that doesn't work very well.
Journey of toast. Glucose levels rise as a result of the carbohydrate we eat. To help explain what happens in your body when we eat carbohydrates, let's use the example of toast eaten at breakfast time. The main ingredient of toast is starch, which is a complex or long-acting carbohydrate. Many other foods also contain carbohydrates. Carbohydrates break down to provide glucose for the body to use as fuel and energy. How is my toast converted into energy? Once you have eaten your toast, it travels to your stomach and small intestines. The carbohydrate in your toast gets digested into glucose. The glucose gets absorbed into the bloodstream and is taken to all the cells in your body. The glucose moves from your bloodstream to the fluid around your cells called interstitial fluid. The glucose needs to get into your cells so it can be converted to energy. The cells are locked and they need a key, which is called insulin, to let the glucose in. The insulin keys are produced by the beta cells found in the pancreas. Insulin opens the cells and allows the glucose to enter.
Session 2. Practical skills. Your glucose levels will be tested with the help of a special measuring meter, called either a glucose meter or a glucose sensor. Monitoring your glucose levels helps you to balance your insulin with what you eat and your activity levels. It also helps you to look after your diabetes well, which in turn helps you keep healthy later on in life. Without monitoring your glucose, you won't know whether your levels are above or below target. Monitoring glucose also helps the diabetes team work out the right dose of insulin for you to take and whether it needs changing. The number of tests or scans you do each day will change depending on what you are doing. If you are in hospital, the diabetes team will monitor your glucose levels more closely than when you are at home. At home, it is advised to monitor them pre- and post-meals, as well as overnight, at least 5 times each day. You should monitor your glucose more closely if you are unwell, exercising, or if your glucose levels are above target or below target. Some people may use a sensor called a continuous glucose monitoring device, or CGM for short, to keep track of glucose levels throughout the day without the need for excessive finger pricks. This is a great way of understanding your glucose levels and how they respond to certain foods or exercise. It can also be reassuring to have continuous monitoring overnight. There are several CGM devices available.
Monitoring your glucose levels. The level to aim for is between 4 to 7 millimoles per litre. Your glucose levels may be slightly higher after you've eaten, which is normal. It is important from now on that you keep an eye on your glucose level readings. You will find it helps to write them down in a diary to begin with. This can help you to look for patterns. At home, the diabetes team will give you a call and you will be able to discuss your glucose levels. This will help you and your team to know whether you are on the right amount of insulin and to make changes if there are any needed. Your glucose readings are also recorded on your meter and if using continuous glucose monitoring, CGM, in the cloud. When you go to clinic, diabetes team will look at your glucose levels on the computer or from your record book if not using CGM. The team will show you how to do this at home if you have a computer. This helps you to see patterns in your readings. For example, if your glucose levels are often high when you wake up and you are using pens, then your long-acting insulin may need to be increased to bring this back down. Also, if there is a pattern of lots of low readings at a certain time of the day, then you might lower the insulin dose to try and stop these from reoccurring. As time goes by, you will be able to see these patterns yourself, and you and your parents will be educated on how to change the amount of insulin you give yourself.
How to do a finger prick glucose test. A glucose reading is quite simple and you will quickly become good at doing it. 1. Wash hands with soap and warm water and dry thoroughly. 2. Prepare your finger pricker. You will need to prepare your finger pricker by ensuring the needle depth indicator is set properly, usually between 1 and 2, and that you have a clean needle each time. 3. Take a test strip and insert it into the meter, the barcode ending first. 4. Prick your finger with your pricker. Remember, do not prick your thumb or first finger. 5. Ensure that there is enough blood on the finger. Hold the test strip to the spot of blood on your finger. The strip will absorb the blood up. An egg timer will appear on the screen when enough blood has been obtained and give you your glucose reading in approximately 10 seconds. 6. If you are struggling to get enough blood, turn your finger upside down and squeeze the end of your finger as though you are milking it. 7. Place the test strip in the sharps bin and record your blood result in your diary. Changing the needle barrel in your finger pricker. If your finger pricker uses a barrel, to replace it you will need to remove the end cap of the finger pricker, the part with numbers on, to reveal the barrel. Simply remove the barrel by pulling upwards. Place a new barrel, white end down, in the end of the finger pricker and push into place. Replace the cap, ensuring that the needle depth number is set correctly. You will notice that the number below the white lever in the centre of the pricker returns to 6. Your finger pricker is ready to use. Your finger pricking device may vary, so please follow instructions on how to replace needles or lancets that come with the device, or as per your diabetes team. Remember to check the expiry date on the box of strips before using.
Types of insulin. From now on, you will need to take insulin every day. You are going to use 2 types of insulin. One is the rapid-acting insulin. It is also called bolus insulin. This may be called Novorapid, Humalog, Apidra, or Fiasp, also known as ultra-rapid. Others may be available. You take the rapid-acting insulin about 15 minutes before your meal. It starts working after 15 minutes and it is most effective in the first 2 to 3 hours. It works to help keep your glucose levels in normal range. Exactly how long it lasts can be different for different people, but what is important is that the rapid-acting insulin needs to be taken before every meal, like breakfast, lunch, and dinner, as well as for snacks. You will also take another type of insulin, which is called long-acting insulin. It is also called basal insulin. This long-acting insulin may be called Levemir, also known as Detromir, or Glargine, also known as Optitulin, or Degludec, also known as Tresiba, depending on what your hospital has prescribed. Again, others may be available. The reason why you need long-acting insulin is because your body always needs a background level of insulin to help keep the glucose coming from your liver under control. The liver releases glucose to provide your body with a source of energy between meals. If given as an injection, long-acting insulin can be given once or twice a day, but it must roughly be at the same time each day. Whatever time you decide, you will need to stick to it, and you will take the same amount of long-acting insulin every day, unless the diabetes team tells you otherwise. Rapid-acting insulin works quickly and doesn't stay in your body for very long. Initially, you may be on fixed doses of insulin at meal times. We will then teach you how to count the carbohydrate content of your meal. Your mealtime insulin will then vary, depending on what you eat. If you have a big dinner and a small breakfast, then you may need to take more insulin before your dinner than you do before your breakfast. It is very important to keep a record of what doses of insulin you are on. You will also need to have insulin with any snacks. The diabetes team will let you know when this is needed. The long-acting insulin you will take once or twice a day is slow and steady, and it stays in your body for much longer than rapid-acting insulin. Your rapid-acting insulin and your long-acting insulin will come in different colour pens, so you don't get the two kinds of insulin mixed up. However, it has happened before. If you do get them mixed up and inject the wrong type, don't panic. You will need to contact your diabetes team for advice. You'll be told to test your glucose regularly over the next 1 to 2 hours. You may need to eat a large snack with lots of carbohydrate, but it is important that you contact your diabetes team, as their advice will be individual to you.
Preparing the needle. Your insulin pen will look something like a red or blue plastic pen. However, they all work in the same way. The insulin comes in small cartridges. Make sure you check that they are in date before being used. Spare cartridges should be stored in a fridge until needed. Once the cartridge is fitted into your pen, it is safe to use for 28 days before it must be changed. Your pen doesn't need to be kept in the fridge. If you get the types of insulin mixed up, don't panic. Putting a cartridge in your pen. Remove the cap. Twist and unclip the two halves. The cartridge then fits into the barrel. It can only go in one way with the threaded end exposed, so the needle can be attached. Some pens may come preloaded.
Attaching the needle to the insulin pen. Number 1, firstly peel off the foil. Number 2, twist the needle onto the end of the pen. Number 3, remove the clear cap and the inner cap. Keep the clear cap to help you remove the needle later, but the inner cap can be thrown away. Number 4, prime the needle by doing a 2-unit air shot. You need to hold the pen, pull out the end, dial 2 units and press the button on the end of the pen. You should see insulin squirt out of the needle. If you do not see any insulin, then repeat this step. Once you are happy that you have seen insulin coming out the needle, you can move on to the next step. Number 5. Use the dial at the top of the pen to set the correct number or dose to be given. You do this by pulling the end of the pen out and then turning the dial away from you until you get the correct number or dose. To begin with, your diabetes team will tell you your dose and write it down in your glucose diary. Please note that some injection pens go up half insulin unit increments. Number 6. Hold your pen right at the top, near the button on the end of the pen with your finger and thumb in an L shape. Injecting insulin will be demonstrated to you by one of our nursing team and diabetic educators. 7. Press your hand gently on the skin and inject into the leg, stomach or bottom at a 90-degree angle. 8. Count to 10 slowly. 1 elephant, 2 elephants, 3 elephants. 9. Move your hand away from your skin. 10. Remove the needle from the site. Do not rub the site. 11. Dispose of the needle. Replace the clear cap onto the pen and twist it anti-clockwise until the needle is inside the cap. This may require a parent or carer to do. 12. Dispose of the needle into a sharps bin. 13. Needles should only be used once. If they are used more than once, they will become blunt, bend, or hurt. Sometimes there may be a spot of blood when you pull the needle out. This means you have hit a tiny blood vessel under the skin. You can't avoid this and it will not harm you, but you may have a small bruise for a day or so. If insulin leaks out of the injection site, you may not have injected deeply enough. If this happens a lot, you may need to hold the needle in for longer than 10 seconds. Never repeat part of the insulin dose, as this can cause you to have low glucose.
Injection sites. Insulin will be absorbed into the fatty tissue, which is called the subcutaneous tissue. It is just under the skin. The skin is 2 millimeters thick and the needles we use are 4 millimeters long, so the insulin will go just underneath the skin. There are a few places on your body where you have lots of subcutaneous tissue. One of these places is your stomach, especially underneath your belly button. Imagine a smile under your belly button. That is where you can inject. 2 other places are the sides of your thighs and the top of your bottom. These are all where you should do your injections. It is important that you don't get into a habit of injecting into the same place all of the time. Avoid using the same place to inject. If you do inject into the same place all of the time, then you will get a hard lump under your skin. As well as not looking or feeling very nice, the lumps can affect how your insulin works. If the insulin is injected into the lumpy area, it can get trapped for a while. It cannot get on with the job it needs to do in your body. Your glucose levels could rise and then fall because the insulin was slow to get there. It is easier to avoid getting these lumps by changing the size of where you give your injections.
Sharps is the word we use for things like needles, barrels, and your used glucose strips. They are things that you must throw away in a special box called a sharps bin. They are usually yellow in colour, but come in different shapes and sizes. A sharps bin protects the user, any other member of the household, and any people involved in the removal of waste from your home. Sharps injuries are on the increase as more waste is sorted to extract recyclable items. What should go in a sharps bin? Used barrels for finger prickers, insulin pens, injection vials or cartridges, needles or syringes, any sensor or pump cannula, used glucose and ketone strips. A sharps bin is the safest way to dispose of contaminated sharps. Safe disposal in your home. The sharps bin must be correctly assembled and labelled, and the lid must be secure. Bins must be placed out of reach of young children. The lid of the sharps bin must not be removed once the bin contains sharps. Bins that contain sharps must be securely placed on work surfaces, i.e., no part of the bin should overhang the surface on which it stands, and it should not be possible for it to be easily or inadvertently knocked down. Sharps bins must not be filled above the full line. Do not force into a full bin by pushing down with your hands. When bins are full, they must be sealed and labelled. Full bins must be securely stored whilst awaiting collection. Call your local council to see what their method of sharps disposal is. Never put any sharps material directly into domestic waste. If you are out and about, you are not going to carry around your sharps bin with you. If you can't get to a sharps bin, you can put the lid on your needle and either put it in your testing kit or use a small sealed container or needle remover. Later that day, when you get home, you can carefully empty your sharps into the sharps bin.
Session 3A, Food. There is no need for a special diet. The recommended diet is the same as for children and young people without diabetes and is suitable for the whole family. Eating a balanced, healthy diet, including plenty of fruit and vegetables, will give you all the energy and nutrients you need for optimal growth, development, and good health. The Eat Well Guide groups similar types of food together and shows how much of each type of food you should eat every day for good health. Fruits, vegetables, and whole grain carbohydrate should form a large proportion of the food we eat. Include a food from the carbohydrate group with each meal. For example, potatoes, bread, rice, pasta, or breakfast cereals. Eat at least 5 portions of a variety of fruit and vegetables every day. Aim for 2 portions of protein foods each day.
Carbohydrates, proteins, and fats. The foods that we eat are made up of carbohydrates, proteins, fats, vitamins, minerals, and fibre. Whilst they are all important for our health, only carbohydrate foods need insulin for the body to be able to use them. Foods can contain different types of carbohydrates, such as sugars naturally occurring in fruit and milk, or those added to soft drinks, foods made from grains, and starchy vegetables. Both the amount and type of carbohydrate you eat will affect your glucose levels. When you eat, the carbohydrate part of the meal is digested and broken down into glucose, which is then absorbed into the bloodstream. This causes your glucose levels to rise. The insulin you take with each meal or snack allows all the cells in your body to use the glucose from your blood to provide you with energy. Some types of carbohydrate foods increase your glucose levels more quickly than others. Refer to the section on glycemic index. Fast-acting, sugary, or simple carbohydrate, such as sugar and sweets, are broken down very quickly within a few minutes into glucose and absorbed into the bloodstream. Long or slow-acting, starchy or complex carbohydrate, such as bread, rice, pasta, and potatoes, are digested more slowly into glucose over 1 to 2 hours and then absorbed into the bloodstream. The amount of fat or protein in a meal or snack may also affect your glucose levels, but it is important to learn about the effect of carbohydrates initially, as they have the biggest impact on blood glucose levels.
Insulin. Regardless of the type you eat, all carbohydrates make your glucose level rise, therefore they all need to be matched with rapid-acting insulin. The carbohydrates you eat will be used for energy your body needs, and some will get stored as glycogen in the liver and the muscles to provide energy at other times when your body needs it. Rapid-acting insulin should ideally be given 15 to 20 minutes before eating any carbohydrates, so that the insulin is ready in the body to start working as soon as you start eating. If you have too much carbohydrate for the dose of insulin prescribed, your glucose will stay high. If you do not eat enough carbohydrate for the dose of insulin prescribed, then your glucose may drop too low. To fine-tune this and prevent highs and lows, we will teach you to adjust your insulin for the amount of carbohydrate you eat. This is called carbohydrate counting.
Meals and snacks. Small snacks can be an important source of energy. It is important to eat regular meals with a variety of foods, including a starchy carbohydrate food. So always make sure you fill up properly at meal times. Healthier choices, which all require insulin. Low GI cereal and milk, fruit, toast, a yogurt, a sandwich, glass of milk, tea cakes, crackers, crumpets, rice cakes, oat cereal bars, plain popcorn, or breadsticks. Other snacks that also require insulin. Crisps, cakes, biscuits, or chocolate. Foods which contain a lot of added sugar, such as sweets, are best eaten in small amounts occasionally and at the end of a meal due to their high sugar content. If eaten on their own, they will cause your glucose level to rise too quickly. A lot of people find they are very hungry just after they have been diagnosed with type 1 diabetes. This is normal and will settle down after a few days or weeks. We will teach you to work out the amount of insulin you need to inject for your chosen snack. Carb-free or low-carb snacks. No insulin required. Healthy choices. Raw vegetables or salad with dips such as salsa or hummus. Avocados, olives, nuts, but only for children over 5 years. Pumpkin, sunflower or sesame seeds. An omelette and grilled tomatoes, scrambled eggs or boiled egg. Sliced chicken, turkey, ham or tuna with a mixed salad. Matchbox-sized portion of cheese. Sugar-free jelly or sugar-free ice poles. Berries or cottage cheese. Less healthy choices. 2 or 3 cocktail sausages. 1 pepperoni stick. Low-calorie hot chocolate. Processed meats. Important to note, while having lower carbohydrate snacks, such as processed meats, can be filling, it is important not to have them too often, as the additional saturated fat and salt they contain is not healthy. However, cheese is a good source of calcium and is a suitable snack for small children.
Drinks. Drinking water regularly throughout the day is important for keeping you healthy and hydrated, especially when the weather is warmer or when you are more active and exercising. Drinking water is advised, especially if your glucose level is above target, to prevent dehydration. Drinks labelled no added sugar, such as diluted squash, or soft drinks labelled diet, contain minimal amounts of sugar and are okay to have occasionally. Frequent consumption is not healthy for your teeth, as these drinks are acidic. Check the label for trace 0 grams or less than 1 gram sugar per serving. Milk is a healthy choice because it contains calcium, which helps to build healthy bones and teeth. Milk contains the natural sugar lactose, so it will need to be matched with rapid-acting insulin. Fruit juice is best avoided between meals because of the natural sugar it contains called fructose, which is absorbed very quickly into the bloodstream. It is best consumed with a main meal or saved as a hypo treatment. If you wear a glucose sensor, good hydration helps to make sure that these work well.
Food labels can help you calculate how many carbohydrates the food contains. The Nutrition Information Panel will give you information about the total carbohydrate per serving and per 100 grams, as well as the sugar per serving and per 100 grams. The sugar value is included within the total carbohydrate value and may include natural sugars within the food, such as fruit or milk sugars, as well as added sugars. When counting carbohydrate, it is the total amount of carbohydrate that needs to be used. This includes all of the starch and sugars within the food.
Different types of sugar and sweetener, such as brown sugar, ghee, jaggery, honey, and syrup, have the same effect on glucose levels as white sugar. You can still use regular sugar to sweeten foods, as long as it's used in small amounts. For example, 1 teaspoon of sugar on porridge or a thin spread of jam on wholemeal toast. Alternatively, you can use granulated or tablet sweeteners to replace sugar in drinks, to sweeten porridge or other cereals, or to sweeten fruit, milk puddings and custard. Suitable brands include Canderel, Sweetex, Hermositas, Splendor and Truvia. The glycemic index, GI for short, is a measure of how quickly carbohydrate is broken down into glucose in your digestive system and absorbed by the body into the blood. While low GI foods may be beneficial in keeping your glucose levels stable, some low GI foods, such as takeaways and pizzas, are not the healthiest choices and can cause high glucose levels many hours after eating. Therefore, aim to incorporate a range of healthy, low GI carbs into your diet. Rapid or fast-acting carbohydrates are classed as high GI. Your insulin cannot work this quickly, so high GI foods and drinks are best avoided, unless you are using them to treat a hypo or to manage exercise. Long or slow-acting carbohydrates are classed as low GI. Low GI foods result in a slow and steady rise in glucose levels over several hours.
Here are some healthy, lower GI choices when eating carbohydrates. For bread, choose multigrain, seeded, rye, chapati, whole grain, and pita breads. For potatoes, choose potatoes with skins and sweet potatoes. For pasta, choose noodles and whole grain varieties. For rice, choose basmati rice. For other grains, choose bulgur wheat, barley, couscous and quinoa. For breakfast cereals, choose porridge oats and bran cereal. For pulses and beans, choose butter beans, kidney beans, chickpeas and lentils. For fruits, choose apples, grapes, oranges, kiwi, plums, pears. Bananas have a lower GI when eaten less ripe. For dairy products, choose cow's milk, plain yogurt and Greek yogurt. But remember, although many factors determine how quickly a carbohydrate will raise your glucose level, ultimately the most important thing is the quantity of carbohydrates eaten in the meal and ensuring that the appropriate amount of insulin is given. Routine monitoring of your glucose levels will help you determine your own response to different types of carbohydrate.
Eating out. You can still enjoy parties and meals out with family and friends. Have your meal in front of you before injecting insulin. If you are eating out, make sure the meal is in front of you before injecting your rapid-acting insulin. Order an alternative if you do not like what you have ordered. If you find you do not like the meal you have ordered and cannot eat the carbohydrate part of your meal, then order an alternative, such as a bread roll, to replace the carbohydrate and prevent a hypo later on. Takeaways are often high in fat. Takeaways can still be enjoyed as an occasional treat. You may notice that some takeaway foods affect your glucose levels differently to foods and meals you eat at home. If you experience problems, your diabetes team will explain how to manage your glucose levels for meals with a high fat content. See section on glycemic index.
Good eating habits. Developing good eating habits from childhood teaches young people to eat the right amount of food at the right times and so encourages a healthy diet for life. Filling up properly at meal times and including vegetables or salad and a good protein source with meals can prevent unhealthy snacking between meals. You can achieve good eating habits by eating regular meals. Breakfast, lunch and an evening meal, ideally sitting and eating with other family members or friends. Filling up properly at meal times and including vegetables or salad with meals. Getting into a good routine helps you to eat the right amount of food to grow, stops you from eating unhealthy snacks between meals, and ensures you maintain a healthy weight. It is also important for controlling your glucose levels. Healthy eating and long-term health. A variety of factors can contribute to good long-term health, including being a healthy weight, eating plenty of fruit and vegetables, having less saturated fat by eating less snacks such as biscuits and crisps, less fatty meats, and less full-fat dairy products, eating foods with a low glycemic index, eating freshly prepared foods and limiting intakes of added salt and highly processed foods, such as chips, processed meat, and tinned or packaged foods. Healthy eating can reduce the risk of cardiovascular disease for everyone. Carbohydrate counting and ratios. Learn how to change your insulin dose for your portion size of carbs. Carb counting gives you better control as you have the flexibility and freedom to have bigger or smaller carb portions each day and match the insulin dose to exactly what your body needs. You will need to work out the grams of carbohydrate you want to eat based on the weight of your portion. The diabetes team will give you a calculation to use so you can work out how much insulin you need for the grams of carbs you are going to eat. For example, you may need 1 unit of insulin for every 5, 10, 15 or 20 grams of carbs. Everyone is different. These values are insulin to carbohydrate ratios, or ICR, referred to as ratios or carb ratios for short. This information will be set by your diabetes team and can be programmed into smartphone apps that can help to calculate your insulin dose. You need to know the glucose level and the amount of carbs in your meal, so checking your glucose levels and learning to accurately carb count are really important. In summary, your carb ratio is the number of grams of carbohydrates for which you need 1 unit of insulin. It can vary over the day. Typically, you need more insulin for the same amount of carbs earlier in the day. You can still enjoy parties and meals with friends. Which foods do you need to carb count? Breakfast cereals, bread, potatoes, rice, pasta, noodles, chapati, naan bread, sweet potato, couscous, bulgur wheat, quinoa, crumpets, crackers, and anything made from flour. Fruit and fruit juice. Battered or crumbed foods, sausage rolls, pies or pastries, and samosas. Baked beans don't contain carbs, but you will need to count the sugar added to the tomato sauce. Milk, yogurt, custard, ice cream, and white sauces. Sweets, chocolate, crisps, savoury snacks, biscuits, cakes and desserts, sauces and gravy. Which foods don't you need to carb count? Meat, chicken, fish and seafood without batter, breadcrumbs, pastry coatings or toppings. Eggs, cheese, nuts and seeds, butter, lard, ghee, margarine and cooking oils, vegetables and salad, a small amount of cream, squirty, double or single cream, etc. Mayonnaise.
Sugary drinks and sweets. Most carbohydrate foods are easily matched with insulin. However, full sugar drinks are best avoided altogether, unless treating a hypo or using to manage exercise. This is because they will cause your glucose level to rise too quickly. Eating whole fruit is better because it results in a slower rise in glucose levels. Sweets which are made almost entirely of sugar, such as jelly beans or fruit pastels, are best avoided or only eaten occasionally as a treat. Using food labels. Working out the carbs in a portion of food. An easy way to start learning your carb values is to focus on food labels, which include nutritional information, such as energy, fat, of which saturates, total carbohydrates, of which sugars, fiber, protein, and salt. Using the carbohydrate per 100 grams value. Some labels will only tell you the carbohydrate per 100 grams. If you would like to eat more or less than this, you will need to weigh your portion and do a calculation. The best scales to use for this are flat digital weighing scales. 1. Switch the scales on. 2. Place the empty bowl or plate on the scales. 3. Press the 0 or tear button. The scales will now show 0 grams. 4. Add the food and the scales will now tell you the weight of the portion. The next step is to find the carbs per 100 grams from the food label. Working out the carbs in a bowl of breakfast cereal. You will need to find the carbs per 100 grams from the label and the weight of your portion using digital scales. Dividing carbs per 100 grams by 100 will give you the carbohydrate in 1 gram of food. You can then multiply this value by the number of grams you are eating to work out the carbohydrate value of your portion. For example, your food label tells you there is 80 grams carbohydrate per 100 grams from the food label, and you weighed 60 grams of cereal. 80 divided by 100 times 60 equals 48 grams of carbs in your portion of food. Working out the carbs in a portion of pizza. If you are going to eat a food containing carbs that is being split into several portions, such as pizza, it is better to work out the carbs in the whole food item first, and then divide by the number of portions. For example, if you are going to eat 1/6 of the whole pizza, then divide by 6. If the food label tells you that there is 30 grams of carbs per 100 grams of pizza, and that the whole pizza weighs 300 grams. The pizza is cut into 6 slices, and you are going to eat 1 slice. There is 30 grams of carbohydrate per 100 grams from the food label, and the weight of the whole pizza is 300 grams. The calculation to use is carbs per 100 grams from the food label divided by 100 and times by the weight of the whole pizza. 30 divided by 100 times 300 equals 90 grams of carbs in the whole pizza. So 1 slice equals the amount of carbs in the whole pizza divided by 6 slices. 90 divided by 6 equals 15 grams of carbs per slice. Books and apps are available to help you work out the carb content of your food. Books like Carbs and Cows may be helpful to get you started. Carbs and Cows is a resource that shows photographs of different portion sizes along with the weight of the food and the carb value of each portion. Find the portion that matches what you want to eat, weigh out that portion, and use the carb value listed. If you have worked out the carb value of your portion and the portion fills a favourite cup or bowl, the next time you can measure out your serving using the cup or bowl without the need to weigh.